When officers respond to a call for intimate partner violence in Windsor, they immediately contact support staff from Windsor Regional Hospital, Hiatus House, or Family Services Windsor Essex, connecting survivors with social workers in real time. It's part of the IPV response program launched last fall. According to Windsor Regional Hospital, its team responded to 19 calls over a recent 27-day period. But since different agencies cover different days, the scale of the crisis becomes clearer when factoring in all responses.
So if you add to their 27 days, our 49 days, with another 270 calls, that number just looks more alarming as you add it up. And if we were to add the family services calls, it would be even greater.
Often, after police lay charges related to IPV, officers refer victims to whichever support organization is working that shift. Hiatus House says most of the people it has helped had never reached out for support before. That referral becomes a first step towards seeking emergency shelter and more.
Just making the connection, even though they're not open or, in that moment of crisis, when police are on site, they're not really wanting a service. Often they come back to us afterwards.
Hiatus House says the high number of calls through the IPV response program further highlights the need for the provincial government to declare it an epidemic. In a statement, the province did not answer why it hasn't done so, despite a direct question from CTV News. Instead, a spokesperson pointed to Ontario's investment in prevention programs, funding for survivor support services, and they also noted the provincial government is conducting a study of IPV through a legislative committee.
There have been several inquests that have called for intimate partner violence being declared as an epidemic, and the provincial government continues to hesitate on that matter.
And according to data from a provincial coalition tracking cases of femicide, 62 people were killed by a family member in Ontario last year. But that number, Stephanie, only includes cases reported in the media.